Question 1. You are tracking a client's hand flapping behavior, which occurs at a high rate. You need a measurement system that captures every instance accurately within a short observation period, example, 10 minutes. Which measurement method would be most appropriate and feasible? A. Percentage of occurrence. B. Momentary time sampling. C. Frequency. Event recording. D. Duration. Answer: C. Frequency. Event recording. This question is testing your ability to choose the most appropriate measurement method based on the characteristics of the behavior. The keywords are hand flapping behavior, occurs at a high rate, and needing to capture every instance accurately within a short observation period. Since hand flapping is a discrete behavior with a clear start and end, and you need to count every instance, frequency, also known as event recording, is the best choice. Percentage of occurrence requires discrete trials with clear opportunities. Momentary time sampling is an estimate and wouldn't capture every instance, especially with a high-rate behavior. Duration measures how long the behavior occurs, not how many times. For a high-rate countable behavior where you need the total count, frequency is the standard. Think of it like counting every time someone claps. Frequency is the way to go for discrete actions. Question 2. A client engages in hitting peers during unstructured free play. An FBA suggests the behavior is maintained by attention from the teacher and peers, screams, telling the client no. You develop an intervention that includes teaching the client to tap a peer on the shoulder and ask, "Play," and praising them heavily for using this new skill, while teachers minimize attention for hitting. What behavior change procedure is this an example of? A. Response cost. B. Differential reinforcement of alternative behavior. DRA. C. Positive punishment. D. Non-contingent reinforcement. NCR. Answer: B. Differential reinforcement of alternative behavior. DRA. This question tests your understanding of differential reinforcement procedures. The keywords are teaching the client to tap a peer and asking play, an alternative appropriate behavior, and praising them heavily for using this new skill, reinforcing the alternative behavior, while simultaneously minimize attention for hitting, withholding reinforcement for the problem behavior. This is the core of differential reinforcement of alternative behavior, DRA. You reinforce a desired behavior that is an alternative to the problem behavior, and you withhold reinforcement for the problem behavior itself. Response cost is removing a reinforcer. Positive punishment involves adding an aversive stimulus. Non-contingent reinforcement involves providing the reinforcer for the problem behavior on a fixed schedule, regardless of behavior. DRI teaches and reinforces what you want the client to do instead. It's like teaching a child to raise their hand instead of shouting out answers, and then praising them for raising their hand. Question 3. You are presenting a graph showing a client's biting behavior over several weeks. The graph shows baseline data, high biting, then intervention data, low biting, and then a return to baseline. Biting increases again. Finally, the intervention is reintroduced and biting decreases again. What experimental design does this graph most likely represent? A. Multiple baseline design. B. Changing criterion design. C. Reversal design, ABA or ABAB. D. Alternating treatments design. Answer: C. Reversal design, ABA or ABAB. This question is asking you to identify an experimental design based on how the intervention is introduced and removed. The key pattern described is baseline, A, then intervention, B, then a return to baseline, A, and finally intervention reintroduced, B. This pattern of introducing and withdrawing the intervention to see if the behavior changes with it is characteristic of a reversal design, specifically an ABAB design in this case, because the intervention is reintroduced. A multiple baseline design introduces the intervention across different behaviors, settings, or people at different times. A changing criterion design gradually changes the requirement for reinforcement, and alternating treatments design quickly switches between two or more conditions. The core feature of a reversal design is removing and reintroducing the intervention to show its effect. It's like turning a light switch on and off to show that the switch controls the light. Question 4. A behavior analyst is asked by a funding source to reduce a client's hand flapping because it looks weird, even though an assessment has shown it does not interfere with the client's learning or social interactions, and the client appears to enjoy it. Ethically, what should the behavior analyst prioritize? A. The funding source's request to reduce the behavior. B. Reducing the behavior because it might be stigmatizing. C. Discussing the assessment findings with the funding source and prioritizing goals based on client benefit and assent/consent. D. Implementing a punishment procedure to quickly suppress the behavior. Answer. C. Discussing the assessment findings with the funding source and prioritizing goals based on client benefit and assent/consent. This question tests your understanding of prioritizing client welfare and using assessment data to guide intervention decisions, even when external pressures exist. The keywords are funding source, reduce, because it looks weird, and assessment has shown it does not interfere, and client appears to enjoy it. Ethical practice requires prioritizing the client's well-being and using data, like the assessment findings, to determine what behaviors truly need changing. Simply following the funding source's aesthetic preference without evidence of harm is not ethical. Reducing a behavior just because it looks weird goes against focusing on socially significant behavior change that benefits the client. Implementing punishment is generally a last resort and would be unethical here as the behavior isn't causing harm. Your responsibility is to advocate for the client based on data and ethical principles, explaining this to the funding source and involving the client/guardian in goal setting. Always let assessment data and client benefit drive your goals, not external opinions about appearances. Question 5. You are conducting a training for parents on implementing a visual schedule. One parent asks how to handle their child having a tantrum when the schedule indicates it's time for a non-preferred activity. According to ABA principles, what is the most appropriate initial recommendation? A. Immediately remove the non-preferred activity to stop the tantrum. B. Use physical guidance to force the child to transition. C. Explain patiently why the child must follow the schedule. D. Guide them on responding consistently, example, prompting the transition while withholding reinforcement for tantrum, and reinforce compliance. Answer. D. Guide them on responding consistently, example, prompting the transition while withholding reinforcement for tantrum, and reinforce compliance. This question is about applying behavior change principles to a common parenting scenario involving transitions and challenging behavior. The core issue is a tantrum occurring when faced with a demand, transitioning to a non-preferred activity. Option A is essentially reinforcing the tantrum by removing the demand, making future tantrums more likely. Option B might be necessary in safety situations, but is generally not the first or preferred strategy for teaching transitions. Option C relies on verbal reasoning, which is often ineffective during a tantrum. Option D aligns with ABA principles. Teach the parent to be consistent in presenting the demand, transition. Reduce reinforcement for the tantrum, like attention or escape from the demand, and heavily reinforce the desired behavior, following the schedule or transitioning. This teaches the child that tantrums don't work to escape, but compliance does. It's about teaching the parent to manage the situation using principles of extinction and differential reinforcement. Question 6. You are interpreting a cumulative record graph. What does a flat line on a cumulative record indicate? A. An increasing rate of behavior. B. A decreasing rate of behavior. C. The behavior is occurring at a steady, moderate rate. D. The behavior is not occurring. Answer. D. The behavior is not occurring. This question tests your understanding of how to read a cumulative record graph. A cumulative record shows the total number of responses recorded over time, with each response causing the line to go up one step. The slope of the line tells you the rate of behavior. Steeper slope equals higher rate. If the behavior is not occurring at all during a period, no new responses are added to the total count. Therefore, the line does not go up, it stays flat. An increasing rate would show an accelerating curve. A decreasing rate would show a decelerating curve. A steady rate shows a straight, upward sloping line. A flat line means zero responses occurred during that time period. It's like counting steps taken. If you stand still, the cumulative step count graphs stays flat. Question 7. When using a timeout procedure, what is an ethical consideration related to the environment where timeout occurs? A. It should be a dark, scary, or locked room. B. It must be a safe, non-secluded area that does not block supervision. C. It should contain toys or activities for the client. D. The duration of the timeout should be very long, example, over 15 minutes. Answer B. It must be a safe, non-secluded area that does not block supervision. This question is about the ethical implementation of timeout from positive reinforcement, which is a punishment procedure. Ethical guidelines prohibit the use of timeout procedures that are harmful, humiliating, or endanger the client. A dark, scary, or locked room, option A, is explicitly unethical. A timeout area should be safe, well-lit, ventilated, and situated so the client can be continuously monitored, not secluded in a way that blocks supervision. Option C would negate the purpose of timeout, removal from reinforcement. Option D relates to duration, which should be brief and appropriate, not arbitrarily long. Ethical timeout is about removing access to reinforcement in a safe, monitored way, not about isolation or fear. Always prioritize the client's safety and dignity, even when using a punishment procedure. Question 8. You are conducting a paired stimulus preference assessment with a client. You present 2 items at a time and record which one the client chooses. You do this for every possible pair of items from your set. After scoring, one item consistently has the highest percentage of selections. What does this most likely indicate? A. The item is likely a strong reinforcer. B. The item is likely a punisher. C. The client dislikes the item. D. The assessment results are invalid. Answer A. The item is likely a strong reinforcer. This question tests your understanding of how preference assessments work and how to interpret their results. A paired stimulus, or forced choice, preference assessment directly compares items to see which one a client chooses when given a choice between 2. The more often an item is chosen over other items, the higher its preference value. While preference doesn't guarantee the item will function as a reinforcer, which is determined by its effect on future behavior. Items consistently chosen in a preference assessment are likely to be effective positive reinforcers. They are definitely not punishers, things that decrease behavior. So, a high selection percentage strongly suggests the item has reinforcing potential. It's like seeing someone always pick chocolate ice cream over vanilla, strawberry, or mint. They'd likely find chocolate very reinforcing. Question 9. A supervisor is providing feedback to an RBT on their implementation of a discrete trial training (DTT) program. The supervisor notes the RBT is not waiting long enough after presenting the SD instruction before providing a prompt, which is making the client prompt dependent. The most effective feedback from the supervisor, based on behavioral principles, would focus on A. Telling the RBT they are doing a bad job. B. Explaining the theory behind prompt dependency in a complex way. C. Providing specific, objective feedback on the RBT's behavior example you prompted within 1 second on 80% of trials, and demonstrating the correct timing. D. Reducing the client's DTT sessions until the RBT figures it out. Answer C. Providing specific, objective feedback on the RBT's behavior example you prompted within 1 second on 80% of trials, and demonstrating the correct timing. This question is about effective behavior analytics supervision and feedback. The problem is a specific skill deficit in the RBT's prompting. Effective behavioral feedback focuses on observable behavior. Telling someone they are doing a bad job, A, is subjective and unhelpful. Explaining complex theory, B, might be part of training but isn't direct performance feedback. Reducing client sessions, D, is not a training strategy. The most effective approach, C, is to provide concrete, measurable feedback on the problematic behavior. Prompted within 1 second on 80% of trials. Show them the correct way to do it, demonstrating the timing, and potentially have them practice and receive feedback. This is applying behavioral principles to teaching the RBT. Just like we break down skills for clients, break down and target specific behaviors for your supervisees when providing feedback. Question 10. You are using a variable ratio, VR5 schedule of reinforcement for a client's task completion. What does the VR5 mean? A. The client earns reinforcement after completing 5 tasks consistently. B. The client earns reinforcement for the first task completed after an average of 5 minutes. C. The client earns reinforcement after completing an average of 5 tasks. D. The client earns reinforcement after a fixed amount of time, which varies. Answer: C. The client earns reinforcement after completing an average of 5 tasks. This question tests your knowledge of basic reinforcement schedules. The key terms are variable ratio and the number 5. A ratio schedule means reinforcement is delivered based on the number of responses. Tasks completed, in this case, variable means the number changes from one reinforcement to the next, but it averages out to a specific number. So, a VR5 means reinforcement is delivered after a variable number of responses that averages 5. Option A describes a fixed ratio, FR, schedule. Option B describes a variable interval, VI, schedule. Option D is not a standard schedule type. VR schedules are known for producing high, steady rates of responding because the client never knows exactly which response will pay off. Think of a slot machine. You pull the lever, respond. A variable number of times for a payoff, reinforcement, averaging a certain number of pulls per win. Question 11. When implementing extinction for a behavior that was previously reinforced with attention, what is a common temporary effect you might observe? A. The behavior immediately stops completely. B. The behavior temporarily increases in frequency, intensity, or duration. C. The client develops a new appropriate behavior. D. The behavior changes form significantly. Answer: B. The behavior temporarily increases in frequency, intensity, or duration. This question is about the phenomenon known as an extinction burst. When you stop providing the reinforcement that was maintaining a behavior, extinction. It's common for the behavior to temporarily get worse before it gets better. This can manifest as the behavior happening more often, harder, lasting longer, or new but similar behaviors appearing. Response variation. Option A is rarely what happens. Option C is the goal of teaching a replacement behavior, which should happen alongside extinction, but isn't the direct effect of extinction itself. Option D, response variation, can happen, but the increase in parameters like frequency/intensity is a more defining feature of the burst. Understanding extinction bursts is crucial so you don't accidentally give in during this temporary worsening, which would make the behavior even harder to get rid of in the future. It's like when you can't connect to Wi-Fi. You might try clicking the refresh button repeatedly and forcefully before giving up. Question 12. You are setting up a data collection system for a client's screaming behavior during transitions. The behavior is loud and disruptive, but you are also tracking multiple other behaviors. Which measurement system might be most practical and still provide a reasonable estimate of this behavior's occurrence during specific periods? A. Continuous measurement, frequency/duration. B. Partial interval recording. C. Whole interval recording. D. Latency. Answer: B. Partial interval recording. This question asks you to choose a practical measurement method given constraints, tracking multiple behaviors. For a behavior that you need an estimate of occurrence within intervals, screaming is a clear behavior you could theoretically track continuously, but doing so while tracking others might be difficult. Latency measures the time to the behavior. Whole interval recording requires the behavior to occur throughout the entire interval, which isn't ideal for a discrete behavior like screaming. Partial interval recording, PIR, requires you to simply mark if the behavior occurred at any point during the interval. This is often easier to manage when tracking multiple behaviors simultaneously and gives a good estimate of how often intervals are affected by the behavior, making it practical while still being informative for this type of behavior. PIR tends to overestimate the actual frequency or duration, but is a common and practical choice for estimating occurrence during intervals. Question 13. A client consistently throws their toys when they are asked to clean up. Demand. An FBA indicates this behavior is maintained by escape from the task. What is the most appropriate function-based intervention component related to the consequence of throwing the toys? A. Provide attention when they throw toys. B. Allow the client to escape cleaning up when they throw toys. C. Prevent escape from the cleaning task when they throw toys and prompt compliance. D. Give the client a preferred toy after they throw. Answer: C. Prevent escape from the cleaning task when they throw toys and prompt compliance. This question requires you to apply the concept of function-based intervention, specifically focusing on the consequence of the challenging behavior. The FBA identified the function as escape from cleaning up. Demand: to decrease escape-maintained behavior, you must prevent the behavior from successfully resulting in escape. Option A provides attention, which isn't the identified function. Option B directly reinforces the escape function, which would increase the behavior. Option D provides a preferred item, unrelated to the escape function. Option C directly addresses the function. The client is not allowed to escape cleaning up when they throw toys. This breaks the link between throwing and getting out of the task. It's paired with prompting compliance to teach them the appropriate way to respond to the demand. For escape-maintained behavior, the consequence intervention often involves consistent task presentation, preventing escape. Question 14. You are using a token economy system. A client earns tokens for completing steps of a task analysis. The tokens can be exchanged later for 10 minutes of playtime. What is the conditioned reinforcer in this scenario? A. Completing the steps of the task analysis. B. The 10 minutes of playtime. C. The tokens. D. The task analysis itself. Answer: C. The tokens. This question tests your understanding of conditioned and unconditioned reinforcers within a token economy. In this system, the tokens initially have no inherent value, but they become reinforcing because they are paired with access to a known reinforcer, playtime. Things that gain their reinforcing power through learning or association are called conditioned reinforcers, or secondary reinforcers. The playtime, B, is the unconditioned reinforcer, or backup reinforcer, something that is naturally reinforcing. Completing the steps, A, is the behavior being reinforced. The task analysis, D, is a tool for breaking down the behavior. The tokens are the learned rewards that bridge the gap between the behavior and the ultimate payoff. Think of money. It's just paper until you learn you can exchange it for things you want. Money is a conditioned reinforcer. Question 15. A behavior analyst designs an intervention for a client's self-injurious behavior, SIB. They propose using a highly aversive consequence delivered immediately contingent on SIB occurrence. Before implementing this, according to ethical guidelines, what steps must be taken? A. Obtain verbal consent from the parent. B. Ensure less restrictive procedures have been attempted and failed. Obtain informed consent. Involve an ethics review committee if required, and ensure ongoing data collection and assessment. C. Simply document the plan in the client's file. D. Implement it immediately if the SIB is severe. Answer: B. Ensure less restrictive procedures have been attempted and failed. Obtain informed consent. Involve an ethics review committee if required, and ensure ongoing data collection and assessment. This question is about the stringent ethical requirements for using restrictive or aversive procedures, particularly punishment for serious behaviors like SIB. The keywords are highly aversive consequence, immediately contingent, and self-injurious behavior. Because this is a potentially harmful procedure for a serious behavior, the ethical bar is very high. You must first demonstrate that less restrictive methods have been tried and failed. You must obtain fully informed consent, which is more involved for aversive procedures. Many ethical codes or organizations require review by an independent ethics committee, and continuous objective data collection is vital to monitor effectiveness and potential side effects. Verbal consent, A, is insufficient. Simply documenting, C, isn't enough. Implementing immediately, D, even for severe of SIB, without these safeguards is unethical. Using aversive procedures is a serious decision with many ethical layers. Question 16. You are evaluating the effectiveness of a new intervention for increasing a client's social interactions during group activities. Your graph shows baseline data followed by intervention data where interactions increased. However, you know that the client also started attending a social skills group outside of your sessions at the same time the intervention started. What threat to internal validity is most relevant here? A, maturation. B, history. C, adaptation. D, observer drift. Answer B, history. This question tests your understanding of threats to internal validity in experimental design. Internal validity is about whether your intervention, and only your intervention, was responsible for the observed change in behavior. History refers to events that happen outside of your planned intervention, but occur at the same time and could influence the behavior. In this scenario, the new social skills group, an outside event, started concurrently with your intervention. It's possible that the social skills group, not your intervention, caused the increase in social interactions. This outside event is a historical factor that threatens your ability to confidently say your intervention caused the change. Maturation is changes due to the passage of time, like growing older. Adaptation is getting used to the observation process. Observer drift is inconsistency in data collection. History is about concurrent outside events. Be mindful of what else is happening in the client's life when evaluating your data. Question 17. A client exhibits spitting behavior that is maintained by automatic reinforcement, sensory input from spitting. The behavior is not harmful or disruptive. According to a focus on least restrictive and client-centered approaches, what would be a reasonable first step in addressing this behavior? A. Implement a response blocking procedure. B. Implement a punishment procedure. C. Conduct a preference assessment for alternative sensory activities and provide enriched access to them. D. Ignore the behavior completely. Answer C. Conduct a preference assessment for alternative sensory activities and provide enriched access to them. This question is about applying ethical principles, least restrictive, client-centered, and function-based intervention for automatically reinforced behavior. The function is automatic reinforcement, sensory input. The behavior is not harmful or disruptive. In such cases, the most ethical and often effective initial approach is to provide competing forms of stimulation. Options A and B, response blocking, punishment, are more restrictive and not typically the first choice for non-harmful automatic behavior. Ignoring D might be part of extinction if it were socially maintained, but it doesn't address the sensory need fueling automatically reinforced behavior. The most appropriate initial step, C, is to find other acceptable ways for the client to get similar sensory input, using a preference assessment to identify what they like, and make those alternatives readily available. This offers a functional alternative before considering more intrusive methods. Give them other ways to get the sensory feeling they are seeking. Question 18. You are trying to teach a client to tie their shoes using a backward chaining procedure. The task analysis has 10 steps. You prompt the client through steps 1 to 9, and the client independently performs step 10, pulling the laces tight. Once they master step 10 independently, what is the next step in backward chaining? A. Prompt steps 1 to 8. Client independently performs step 9 and 10. B. Prompt steps 1 to 9 again until completely mastered. C. Have the client perform all 10 steps independently. D. Begin teaching forward chaining instead. Answer: A. Prompt steps 1 to 8. Client independently performs step 9 and 10. This question tests your understanding of backward chaining. In backward chaining, you teach the steps of a task analysis in reverse order. You prompt or complete all steps except the last one, which the client learns to do independently first. Once the last step is mastered, you then require the client to perform the last 2 steps independently, while you prompt the ones before, and so on, moving backward through the chain. So if step 10 is mastered independently, the next step is to prompt steps 1 to 8 and have the client independently perform steps 9 and 10. You continue this process until the client can perform the entire chain from beginning to end. It's like teaching someone to build a tower by having them place the last block, then the last 2, then the last 3, and so on, until they can build the whole thing. Question 19. You have completed an FBA for a client's yelling behavior. The data show yelling occurs most often when the client is alone in a room and stops immediately when an adult enters and talks to them. The behavior occurs less often when others are already present. What is the most likely function of this yelling? A. Tangible. B. Escape. C. Attention. D. Automatic. Answer: C. Attention. This question requires you to interpret FBA data to determine the function of a behavior. The key clues are where and when the behavior occurs, most often when alone, and what happens immediately after, stops immediately when an adult enters and talks to them. When a behavior is more likely when attention is scarce and results in gaining attention, the function is most likely attention. Tangible would involve getting an item. Escape would involve getting out of a demand or situation. Automatic would be maintained by internal sensory input, unrelated to social consequences. The pattern described strongly points to the behavior being reinforced by getting attention from others. It's like a child calling out from their room when they think no one is nearby, and stopping when someone comes in to check on them. Question 20. You are explaining the concept of motivating operations, MOs, to a student. Which of the following is the best simple example of an MO? A. Giving a child a cookie after they say please. B. Telling a child, clean up your toys. C. Making a child wait to eat dinner until after they finish their homework. D. A child learning to say cookie to get a cookie. Answer: C. Making a child wait to eat dinner until after they finish their homework. This question asks for a simple example of a motivating operation, MO. An MO is something that changes the value of a reinforcer and affects the likelihood of behaviors that have been reinforced by that reinforcer. Option A is an example of positive reinforcement. Cookie strengthens saying please. Option B is a discriminative stimulus, SD, an instruction. Option D is learning a new behavior. Option C is the best example of an MO. Waiting to eat dinner makes food, the reinforcer, more valuable, establishing operation, and makes behaviors that have resulted in getting food in the past, like finishing homework to earn dinner access, more likely. Deprivation or satiation are common MOs. Making the child hungry for dinner increases the motivation to do the behavior that leads to dinner. Question 21. A client's aggressive behavior consistently occurs during academic tasks. An FBA suggests the behavior is maintained by escape. You decide to implement an intervention that involves presenting the academic task, but physically guiding the client through it if they engage in aggression, preventing them from escaping. What type of intervention is the physical guidance considered in this scenario? A. Response cost. B. Timeout. C. Positive punishment using guided compliance/response blocking. D. Negative reinforcement. Answer C. Positive punishment using guided compliance/response blocking. This question asks you to identify a behavior change procedure used in a specific scenario involving escape-maintained behavior and a potentially intrusive intervention. The core action is physically guiding the client through the task contingent on aggression, specifically to prevent escape. This added consequence, guided compliance/response blocking, is being applied after the behavior, aggression, and is intended to decrease the likelihood of future aggression in this context because it prevents the behavior from achieving its intended function, escape, and can be considered an aversive consequence in itself, effortful compliance. While the goal is to prevent reinforcement of escape, the physical guidance added immediately after the aggression functions as a form of positive punishment, adding something the client wants to avoid. Being physically guided through the demand. Response cost is removing a reinforcer. Timeout is removal from reinforcement. Negative reinforcement involves removing an aversive stimulus to increase behavior. This procedure adds a consequence. Physical guidance/blocked escape to decrease behavior, fitting the definition of positive punishment. Question 22. You have a client who engages in repetitive vocalizations, echolalia. You are teaching them to label items using discrete trial training, DTT. When you hold up a car and say, "What is it?" the client immediately says, "What is it?" What type of prompt is the client's response? A. Echoic prompt. B. Textual prompt. C. Intraverbal prompt. D. Automatic prompt. Answer. A. Echoic prompt. This question tests your knowledge of verbal operants and types of prompts in DTT. When you say, "What is it?" a verbal stimulus, and the client repeats exactly what you said, that is an example of an echoic behavior. In the context of prompting, if you were trying to teach the client to say car, and you said, "Say car," and they repeated, "Say car," that would be an echoic prompt from you. In this specific scenario, the client's response, "What is it?" is an echoic behavior under the control of your verbal stimulus, "What is it?" While the question is slightly tricky in asking about the client's response as a prompt, it's a behavior influenced by a prompt from you, but functions as if it were an echoic prompt if you intended them to repeat you. Among the choices, echoic is the only term that accurately describes repeating a vocal stimulus. Textual involves reading. Intraverbal is a conversation/answering questions. Automatic is self-stimulatory. The core concept here is vocal imitation. Question 23. A behavior analyst is asked to provide services for an adult client with developmental disabilities who lives in a group home. The client has a history of significant trauma. Ethically, what is a crucial step the behavior analyst must take before developing any intervention plans? A. Focus only on the current challenging behaviors and ignore past trauma. B. Obtain informed consent from the client themselves if they have the capacity or their legal guardian. C. Assume the group home staff have all necessary information and consent. D. Implement a restrictive behavior plan immediately to ensure safety. Answer. B. Obtain informed consent from the client themselves if they have the capacity or their legal guardian. This question emphasizes the ethical principle of informed consent, especially with vulnerable populations and potentially complex histories like trauma. Regardless of setting, group home, or history, you cannot provide services without proper consent. With adults with disabilities, you must first determine if they have the legal capacity to provide their own informed consent. If not, you must obtain it from their legally authorized guardian. Ignoring past trauma. A. Is poor clinical practice. Assuming staff have consent. C. Is irresponsible. You must verify it yourself. Implementing restrictive plans immediately. D. Is unethical and violates the requirement for assessment and less restrictive options. Always verify who has the authority to consent and ensure they understand and agree to the proposed services, especially considering the client's rights and history. Client autonomy and safety are paramount. Question 24. You're consulting with a school team about a student's disruptive behavior in the classroom. They show you a graph of the behavior where the frequency is very high. They have implemented a simple ignore plan, and the graph shows no significant change. Based on this, what is the most likely immediate problem with the current plan? A. Ignoring is never an effective intervention. B. The behavior is likely being reinforced by something other than teacher attention. C. The data collection is inaccurate. D. Ignoring is being implemented inconsistently. Answer. B. The behavior is likely being reinforced by something other than teacher attention. This question requires you to analyze intervention data to infer a potential issue. The school implemented an ignore plan, which is a form of extinction for attention-maintained behavior. The graph shows the behavior did not decrease. This suggests that ignoring the behavior, withholding teacher attention, is not removing the reinforcement that is actually maintaining the behavior. If the behavior were maintained by teacher attention, ignoring it should lead to a decrease over time, after a possible extinction burst. Therefore, the most likely problem is that the behavior is being reinforced by something else, such as peer attention, escape from tasks, or automatic reinforcement. Option A is incorrect. Ignoring is effective for attention-maintained behavior. Option C is possible but not the most likely conclusion solely from the flat graph under an ignore plan. Option D is also possible, inconsistent implementation. But the primary inference from no effect when attempting to remove a specific reinforcer is that the wrong reinforcer was targeted. The FBA should identify the true function. Question 25. A behavior analyst is developing a supervision plan for an RBT. The plan must include clear objectives for the RBT to achieve competence in specific skills. These objectives should ideally be A. Vague statements about improving overall performance. B. Specific, measurable, achievable, relevant, and time-bound. SMART. C. Focused primarily on decreasing behaviors the supervisor finds annoying. D. Identical for all RBTs being supervised. Answer. B. Specific, measurable, achievable, relevant, and time-bound. SMART. This question is about effective and ethical supervision practices, specifically related to setting goals for supervisees. Just like client goals, supervision objectives should be clear and trackable. Using the SMART framework, specific, measurable, achievable, relevant, time-bound, is a best practice for setting effective goals in many fields, including behavior analysis supervision. Vague goals. A. Make it hard to know if the RBT is making progress. Focusing on the supervisor's preferences. C. Is unethical. Objectives should be individualized based on the RBT's needs and the clients they work with, so they shouldn't be identical for everyone. D. Setting SMART goals helps ensure the RBT develops the necessary skills effectively and ethically. Make your supervision goals clear and trackable, just like your client goals.